Hi, I'm Dr. M. Joe Kaushik, andrologist practicing at Caroline John Hospital, Nagarkoil. Today, I'm going to discuss about a interesting topic, varicocele. This is one of the most wanted and asked topic in the field of andrology and male fertility. So, first we should know what is a varicocele. For that, we should understand how is the blood supply of the testis is coming. So, for the blood supply of the testis, it comes to the spermatic cord, which consists of the arteries, lymphatics and the veins. So, if there is any dilatation or dysfunction of the veins, it leads to varicocele. So, literally once the veins blood supply is disrupted, the testicular blood supply is disrupted. So, what are the symptoms this varicocele will cause? So, first we should know the main symptom the varicocele can cause is reduced spermatogenesis, which leads to alteration in the sperm count and quality of the sperm. So, how does it happen? So, once the varicocele occurs, the blood supply to the testis gets disrupted, so that the function of the testis is affected. So, what are the main function of the testis? One is the sperm production and the second one is the testosterone production. So, once the sperm production gets disrupted, the chances of fertility also comes down. So, we should know when this varicocele should be treated and how it is treated. So, to understand that, we should first go into the mechanism which this varicocele cause to the testis. So, varicocele we can understand simply as that. So, in a pipe we can think about a pipe system. So, in the pipe system, if the outflow is blocked, the inflow will be reduced. So, this outflow is through the venous system and the inflow is through the arterial system. The arterial blood vessels carries oxygenated blood and the venous blood carries deoxygenated blood. So, in case of varicocele, this deoxygenated blood gets stagnated, so that the oxygenated blood which is coming into the testis is reduced. This is the first mechanism through which the testicular blood supply is affected and the testicular sperm production is affected. So, the second mechanism, once the blood gets stagnated in the veins, the testicular temperature starts to rise. So, our body is made in such a way that our testis is maintained 1 to 2 degrees Celsius temperature less than the regular body temperature. So, once the blood gets stagnated, this regular maintenance of temperature is affected and the testicular temperature also gets raised, so that the testicular function is reduced. So, the third mechanism is wherever the blood gets stagnated, the endotoxins will be released in that, which in turn affect the spermatogenesis and the matured sperms which are present in the epididymis of the testis. So, we should know, now we are coming to the part when to treat the varicocele and how to treat the varicocele. So, first what we do in our practice is, if a patient presents to us with varicocele and primary and infertility, so we do the semen analysis and we check for the function of his Sertoli and Leydig cell, which are the main components of the testis producing the sperm. So, if the function of the Sertoli and Leydig cells are in the normal range or little it is altered, then varicocele surgery will be effective for this patient, because we can regularize the blood supply and regain the function of these cells. So, the second situation where we operate for the varicocele is, some patients present to us with testicular pain because of this varicocele. If a patient presents to us with testicular pain, then it is mandatory to do a varicocele surgery, so that that pain will also be reduced and his sperm parameters will also be improved. So, how do we treat varicocele? There are so many doctors and so many other medicines, other fields of medicine which include Siddha, Unani and other herbal medicines which they provide medications to correct this varicocele. First, as we know, varicocele is a condition in which the valve system of the veins are affected. So we cannot recreate a valve in case of with the help of oral medications. So what is the best option is surgical option, and the surgical options which are available at present are the microcele varicocele ligation and second varicocele embolization and laparoscopic varicocele ligation and open varicocele ligation, which is the traditional method. Of this microsurgical varicocele ligation is the gold standard method because we used to magnify the spermatic cord and we see the dilated blood vessels and the arteries and the lymphatics separately, so that we can ligate only the veins which has the issues, so that the remaining blood supply of the testis is maintained, so which helps you in helping to improve your spermatogenesis and the quality of your sperm. So the best option for treating the varicocele is a microsurgical varicocele ligation, which is a day care procedure, which means if we operate you in the morning of a day, the same day evening you can go back home. From the next day you can do all your activities, and from the third day onwards you can resume to go back to your work. So even the sexual activity we will allow you to resume after 7 to 10 days. So it is such a minor procedure which gives a wonderful result in case of poor sperm production and testicular pain because of varicocele. Thank you.